Hi, and welcome again to Austin Counseling and Trauma Specialists. Today I want to talk to you a little bit about the different levels of practitioners. So we've talked about in previous videos about LPCs, LCSWs, psychiatrists, psychologists, and the difference between all of those licenses. Today I want to tell you just a little bit about LPCs and our growth from student to fully licensed practitioners. So we begin as master's students, and getting our master's degrees, we have a lot of education, about usually a 61-hour program, somewhere in that number of hours. And in that program, we have a lot of classes, but then towards the end of the program, you become a practicum student. And practicum students work in clinics, and whether those are on campus or whether they're sites like ours at Austin Counseling and Trauma Specialists, where a student can come in and work with clients under my supervision as a site supervisor and under the supervision of their professor in their program. So what that looks like and what they're called are practicum students. Practicum student is in their very first level of work as a clinical student. They're working with a few clients and it's fairly new in their work. That student then becomes a student intern, and that's usually about 2 semesters of their master's degree work. And in those 2 semesters, they are working again in sites like ours or sites at the university and other places where they get to see clients individually, still under the supervision of their site supervisor, someone like me, and their clinical supervisor, usually, again, their professor at the university. Those are the 2 student levels. Once that student graduates with their master's degree, having completed all of their requirements, they can then sit for their license for their LPC intern license. That means that they are an LPC intern and they are not fully licensed, and that person must work under the supervision of an LPC supervisor. An LPC supervisor is simply a fully licensed LPC who has a minimum of 5 years experience and who then applies to be a supervisor for LPC interns. So the LPC intern has this supervisor who they meet with on a weekly basis to discuss their clinical work, to discuss their clients and how they're doing. This helps the intern grow. They have lots of consultation and they have lots of support in their first 3,000 hours of their work. So the LPC intern then completes that 3,000 hours of supervised clinical work. Well, part of it's clinical, part of it's indirect services, learning to do paperwork and things like that. And when they finish that 3,000 hours, they are then they can apply to be a fully licensed LPC. The full license simply means that they can then practice on their own. They can go open up their own practice. They can work in lots of other settings too, and they also do not need the LPC supervisor anymore. However, it's still a good idea for LPCs to sit in on consultation groups, which I think are a lot of fun, where it's kind of like talking to your peers about your clinical work and making sure that you're still doing good work and learning new things. So those are kind of the levels of student practicum all the way up to fully licensed for an LPC. LPCs continue with continuing education. I think it's about 12 hours a year, 24 hours every 2 years for their license, which means they have to continue to do education to keep up to date in the things that are going on in their profession. Lots of checks and balances, lots of training and education from a student practicum all the way up to fully licensed LPC. So that's kind of how we grow up. If you have any questions or want to reach out to us, check out our website, www.austincts.com. If you have any questions, reach out to us. Hope you have a great day. Thanks for watching. Bye-bye.